You'll know when you have a wild woman. She'll practice her craft without boundaries. She is truly autonomous. Her loyalty is only to the family she serves, a midwife who will not allow herself to be held back by a system she didn't create.
This podcast is for the birth keepers who want to grow and change. We are open to learning through self-reflection and supportive community. We are creating this space to explore without judgment. We are remembering we were
Born wild.
Hello, everybody. Welcome back to the Born Wild podcast. I'm your host, Leah.
And Sophia.
Rainy days.
Mm-hmm.
I love the rain, but I'm getting a little sick of it. How was your week, Sophia?
My week? I feel like the last couple weeks, I actually took notes.
Amazing. Let's do it.
I first want to talk about a warning that garlic will burn the skin off your feet. I had a cough for like 7 weeks and I was doing all sorts of things to help it go away. And one of them was garlic and onion on my feet. And it really helped. It really helped. And some garlic is hotter than others. And I didn't realize you can leave the onions on all night, but you should only leave the garlic on for 20 minutes. That piece is really important because I had burns on the bottom of my feet. It was horrible. So yeah, I had that check-in. And then also I have been receiving phone calls asking for Dr. Sophia Henderson. And I decided to just say, speaking.
I got a call from the newborn screen people, and they asked if it was the office of Dr. Sophia Henderson. And I said, well, it's a joint practice. I didn't say this is Dr. Ritter. It's so weird how like I have no desire to be categorized as that because what we do is so different, but it's also kind of like,
but then it's flattering. Yeah.
Dr. Ritter.
Yeah. And then my other update is my son had surgery 2 weeks ago. And I was surprised that it was actually like a lot harder than I thought it was going to be in terms of pain management, because he had 6 surgeries his first year and we just stayed and he was so drugged until we like weaned him and then we went home. So, but like we just went home that day, which I was really happy about. Like, yes, I don't want to stay overnight. And he was on Tylenol and Motrin and all that, but he was in more pain than I thought he was going to be in, like to the point where I was telling you, like, I can't come to work today. He was like screaming. Yeah. He like laughed at his sister. And I thought like maybe something ruptured with the way he was screaming. So it was just a lot harder than I thought. And he'll go back in 2 weeks. He'll be put under again. He had a port put in his belly so that we can do enemas from the top down because of all his bowel reconstructive surgeries. But we were doing enemas through his belly and it's so much better. And he even is like saying it's so much better. So I'm glad we did it. But yeah, it's hard. And then, yesterday I went to Bliss Day Spa with a private group and just got blissed out and massaged and it was amazing. And I'm ready for the week now. What was your life like?
It was a really structured check-in and mine probably won't be as structured.
I took notes because I need notes.
Yes. What happened for me? Yeah, I mean, it was a bit ago, but I had 2 births in a row and, one of them was just this like beautiful, powerful VBAC. You were there. And I'm just still high from it. I guess it was like a month ago, actually. Really? Yeah, I know. It feels like yesterday, but just like, I just love VBAC so much, and I feel like we sort of have a few people who just had these really, really traumatizing cesareans and have come back and doing home birth for their VBAC and just like, it just fills me with so much gratitude for what we do and like the honor of being there. But yeah, it was just really so amazing. And then there was something that was really interesting. We'll talk about on a rant podcast, I guess, about tachypnea. But yeah, I mostly just been mellow with the rain. I had a really fun weekend. Now I went out dancing, which I haven't done for a while, but that was really fun. And yeah, just on call and ready for all the mamas we've got.
We've got a few lined up.
We've got a few lined up. We've got
One warming up.
One warming up right now, which is very exciting. But yeah, I'm feeling really good. And yeah,
Nice.
and I'm very excited for the interview today.
Yes. We are welcoming back Dr. Jen Santos. We can all call her the doctor.
Yes.
Yeah.
We'll link your first episode in the podcast. And wait, were there 2?
We've done at least 2 interviews.
I think I've done 2. Yeah.
Yeah, because we did
It's
the
funny,
one too.
like,
You're our regular.
Yeah, I've had a couple people come in and they're like, I heard you on the podcast, and so I wanted to see you. And I'm like, oh my God, like I'm so famous.
We're having people listen.
Yeah.
Yeah, you guys are getting famous.
Yeah, no, it's like the tongue tie one is just solid gold.
Yeah.
I mean, it's so good. And I've just used so much of the stuff you talked about in the practice. And like all our clients see you, basically. So
Yeah, but today we get to talk about a really fun topic, ultrasounds.
yeah.
So, but maybe we'll give it to you to, just in case this is somebody's first time meeting you, you can give a little introduction about yourself and then we'll dig in.
Cool. So I'm Dr. Jen. I am a chiropractor. I'm one of the owners of Acorn Chiropractic Club. We have an office in Napa, Santa Rosa, and Petaluma. We specialize in the perinatal period and pediatric care. So we've done a lot of advanced training in prenatal care and pediatric care. We also incorporate something called dynamic body balancing, which is a variant of craniosacral therapy. The inventor of dynamic body balancing was actually, is my mentor, Dr. Carol Phillips, and she was the inventor of the sideline release, forward leaning inversion, and a whole bunch of other stuff Spinning Babies still uses today. So pretty cool. Yeah.
So where did your education around ultrasounds begin? Was it in school?
Well, so my education began, my dad was a chiropractor who used ultrasound therapeutically in practice. And so when I got to be I think it was at 10 years old, we were allowed to start helping in practice, in his office on people, working on people, with doing that kind of stuff. So every once in a while he would be like, hey, do you want to do ultrasound? And I'd be like, yeah, sure. And so we would go in there and he taught us how to do it and all the safety and, all of that kind of stuff. And then throughout my teenage years, I was that's one of my jobs in his office was to do ultrasound on people. And one day there was a lady that we had been doing ultrasound on, pretty much every time she came in. And she came in and told my dad, hey, I'm pregnant. And my dad was like, oh, great. Congratulations. That's so exciting. And then I said, oh, are we doing ultrasound today? And he was like, no, you can't do ultrasound on pregnant people. And I was like, wait, what? And I was like, how does that even make sense? So then going through that and kind of asking my dad, why is that you can't do ultrasound? And he's like, well, one is therapeutic and one is diagnostic. And I was like, yeah, but what's the difference? And he's like, well, one is hooked up to a visual machine and the other one is not. And I was like, yeah. And there goes into the differences, hertz and megahertz that are used with it. But ultimately I was like, that doesn't really sit right with me, that it's actually a contraindication to do ultrasound, therapeutic ultrasound when you're pregnant. And I was like, that doesn't make sense to me. So with my first son, we got pregnant, we were trying not to get pregnant when that happened. And and it happened. So my son was born 2 months before we started chiropractic college. So, but when I got pregnant, I was like, I don't want to do any ultrasounds. And my husband was like, well, why not? It seems like that's just what you do in prenatal care. And I was like, it doesn't sit right with me that it's a contraindication for therapeutic ultrasound, but it's perfectly fine for diagnostic ultrasound. I'm like, there's something to that. And so I started looking it up. And at the time, at the time, this was in 2010, or I suppose 2009, because I was pregnant. So in 2009, the American College of Obstetricians and Gynecologists said, do not use ultrasounds like for anything other than diagnostic medical purposes. And that was like plainly stated. And I was like, okay, well, that's kind of interesting. So why, if there's no risk, there's no adverse effects at all, why would they come out and say that? So that kind of like furthered my kind of questioning whether they were really safe. And then I went through chiropractic college. So I didn't really, so we went through my whole pregnancy, didn't do any ultrasounds, and my first due date was given March 5th, and based on palpation and measuring and all of that. But I didn't see somebody until 24 weeks after I found out I was pregnant. So I didn't do any like really early on prenatal care, because I was like, well, what do you do? Well, you just kind of wait. And I think that that's something that we've kind of lost trust in the body, and we've lost like, there's not really, if you're denying all of these like ultrasounds and all this, like there's not really a whole lot that you're going to do in prenatal care. I mean, you guys, might be stepping on.
COVID really showed that, because they were dropping people's appointments and doing Zoom things.
Right.
Like, okay, if it was really that important,
Right.
So
Exactly.
Families, like, your prenatal care is what you do in between our appointments,
Exactly. And that's right. And it's not to say, like, as soon as you find out you're pregnant, go to Lea and Sophia. Like, that's not, but like, there's not a whole lot that's going to be done, because like education is really key. But I was doing that on my own. Like, I was going through the stuff, and I had full trust in the body. And then we were in a car accident, and 2 days after the car accident, I started bleeding. So I was like, okay, we need to go see somebody. So we went out to, I suppose he was I hadn't seen in, 15 years or whatever. And I went out to him and I was like, hey, I'm having, bleeding. Like, I haven't seen anybody for my pregnancy yet. And he's like, all right, well, we're going to do an ultrasound. And I was like, no, I don't want to do an ultrasound. And he's like, well, that's just like standard. And I was like, yeah, but like, I don't want to. And he was like, well, we need to be able to tell that the baby's okay. And I was like, yeah, but I'm at least 24 weeks, because I had found out that I was pregnant 24 weeks ago. And I was like, so can we just listen with a fetoscope? And he like looked at me like I was like, nobody uses a fetoscope anymore.
Right.
And I was like, right, but you're old enough to have learned how to use it. So, so I was like, just do the fetoscope, see if there's a heartbeat. That's really like all that I, am interested in right now. And so immediately, everything was fine. He checked it out, and he gave me the due date of March 5th, based on measuring and all that. And so then I hired my midwife. She came in and she was like, I think it's more like later March. Like, she's like, you're measuring, and my measurements then were consistently pretty small. And she's like, you're measuring way later. So then she gave me the date of March 31st. Ultimately, he was born April 22nd. So I don't know, maybe I was like 44 weeks pregnant, whatever. I don't know. I don't think so. Once he was born, they did like all of his gestational like measurements and stuff. And like his femur, I remember, was like 38 weeks, but his chest was 40 weeks. His vernix looked like he was like 40 weeks, so she was like, he's due exactly when he was born, like no problems.
Yeah.
But we did a few weeks before he was born, at one of my last prenatal appointments, she was like, I think he might be breech. And I was like, okay, well, maybe, does that change how labor and delivery goes? And she was like, yeah, because, basically, it'll kind of depend on like how he's born. Now, this was a time where, you know, my parents were like, all right, well, he's breech, so you'll just have a home birth and a breech baby. And my mother-in-law was like, well, she's a big dairy person, and so she works on a dairy, and she owned a dairy, and she was like, well, cows are born breech all the time. It's not a big deal. I was like, okay. So I definitely had the support of my family just being like, yeah, this is just a normal variant and no problem.
What year was this?
This was 2010.
So it was legal.
So it was legal because it wasn't
Yes.
2014 that midwives had to
Right.
go underground.
Right. Exactly. Exactly. And so my midwife asked, you know, she basically said, like, it's just easier. Breech births tend to start labor really early on, you know, and you tend to be in labor for a long time. Like your water breaks.
Gestational or?
No, sorry. Your water breaks early.
Oh, I see. Okay.
And then you just kind of hang out, and then typically contractions will start later. She's like, so it just, you know, kind of gives me a good idea if you could just go get an ultrasound just real quickly. And so I went in, and the guy was like, all right, you get to see your baby. And I was like, I don't even want to see my baby. Like, I just want you to tell me if there's a head or a butt. Like, that's all. And so he like put the wand on, and he was like, yeah, there's a head. And I was like, all right, take it off. We're done. And like, and that was it. And I was like, all right. And so, and at the time I was not a chiropractor. I was seeing a chiropractor for the Webster technique. I was doing the spinning baby stuff. And that little boy just did not want to flip. So he stayed head up. I did my breech experience was just absolutely amazing. He was double footling. So he came out feet first. Start to finish, my labor, any indication that I was in labor, start to finish, was 3 hours. So yeah, we called the midwife.
We heard about footling breeches.
What?
I said, do you want to hear what we learned about footling breeches?
Yeah.
I was told my daughter was a double footling breech, and we did a workshop with Dr. Stu, and I kind of wanted him to like dispel a bunch of myths I had grown up hearing about breeches. And one of them was that a double footling breech or a footling breech is like the most dangerous because there's more room for like the cord to prolapse, and also that you aren't dilated fully, and you know, it can be entrapped. And he said that unless you're severely preterm, that it's not possible for you to have a footling breech, because a true footling breech is a baby whose hips are not flexed. They're like in a full standing position.
Yeah.
It's not actually possible at full term.
And breeches I've seen, like when we had a surprise breech a couple weeks ago, and we saw a foot, like the leg came out, but it wasn't standing straight up.
Yeah, it was tight. They're more like complete breeches where the foot presents.
And so like thinking about it, talking to midwives, it's like, it's just not possible.
Well, and the reassurance that you get is that because they're not extended, like in a standing position, they do dilate the cervix with their butt and their
exactly.
knees. So he's like, you actually probably like dilate better, you know, or more. So he gave us reassurance that like that is not a situation that you would probably find yourself in at full term, which was reassuring.
Right. Yes. Yeah.
Anyway.
I think the difference, you know, I mean, basically that's always been my question, is with a complete breech is what's the presenting part going to be? Because it's typically, I mean, just by the nature of the complete breech, typically it seems like the feet would just automatically come out first, although they could come out like tucked together and butt and feet together, but no thanks. Maybe.
It doesn't look bad.
Higher than a head. Yeah. No evidence of cervix not being dilated enough.
Yeah. So, I mean, by the time the midwife got there, I was fully dilated, and she was like, oh, okay. She almost missed it because she was like, oh yeah, this is going to be a while. It was not. He came out totally, like, he did come out like feet first, in a little pencil dive. But I get what you're saying, like not standing in utero. But that was my experience. And there was a little bit of like humility because I had touted the whole time, like, I'm not doing any ultrasounds, no way, blah, blah, blah. And then there was my midwife sat down with me and was like, hey, it would be better if we knew if baby was breech or not, you know, just for labor delivery. And so she said, you know, like, but, you know, obviously that choice is yours, blah, blah. And I said, well, ultimately, like, I'm making the choice to birth at home breech. I would much rather have all of the information and be prepared, because I wouldn't want a foot coming out being like, what is that? You know, like, so then I got into chiropractic college. We went through chiropractic college, and in one of our last quarters of chiropractic college, we had to write a paper and present it to our teacher, who was, he was just mean. He was a public health official for the city of Berkeley, and he would basically have students write these papers about public health issues, and he would have you go up there and present the topic, and then he would just tear you apart. So in chiropractic college, generally speaking, chiropractors tend to be more holistically minded, sort of not with the mainstream on like vaccines and circumcisions and, you know, all of that kind of stuff. We tend to be a little more granola. And so she did that. So I said, I want to do my paper on prenatal ultrasounds. And he's like, well, that's not a public health concern. And I was like, oh, I disagree. And let me show you why. And I presented my topic. He didn't love it because, you know, I mean, I think it was challenging him, but everything was researched. It wasn't just like, I feel like this isn't a great thing. It was like, no, this is actually what the research is saying, and we really should be looking at the research. And it's funny to take research, like medical research in like the New England Journal of Medicine, and be like, hey, this is what the research is saying in that. What do you have to say about that? And they're like, oh, well, we've never heard about that. And I'm like, it's not, you know, right. It's like using research that they consider gold standard. Like, okay, here you go. And so I wrote my paper. The three people who presented right before me, like, left screaming and crying, like, because he just like tore them apart, like to their very essence of their being. And I was like, all right, I'm next. Yay. So I get up there and I'm like, all right, so this is why I'm concerned that it's a public health issue. And he was like, all right, that was fine. And I was like, okay, like, and I just sat down and I was like, wow. And that was the nicest thing. Like, everybody in my class was like, that is the nicest thing I've ever heard him say to anybody. And I'm like, okay, like,
They were like,
that was fine. I know. So I was like, all right,
self-worth and
so we needed to look into it. So part of my paper, I found one of the research conversations was from this guy, Dr. Toms, and he said that practitioners of fetal ultrasound operate on a Titanic mentality. Safety is assured, therefore precautions are unnecessary. I would be happy to be proven wrong. And I was like, wow, that is a really, like, very direct, because ultimately at the end of the day, I'm saying maybe ultrasounds aren't the safest. Are they sometimes necessary? Yes. And are most people going to get in a car accident, have vaginal bleeding, and choose to do an ultrasound to make sure everything's okay? Yeah, probably. So I don't want anybody to feel guilty or wrong, or like their decision is the wrong decision based on this, but it's also something where it's not a passive thing. It's not something that should be taken lightly. And so I want to talk a little bit about that too. There are different types of ultrasounds when it comes to pregnancy. There's fetal ultrasounds, or the prenatal ultrasound that we see, the diagnostic ultrasounds that we see like on the screen, and you get to see the heartbeat and you get to, you know, whatever. And they can do that transvaginally with a wand into the vaginal canal, or they can do it on the abdomen. The other one is a Doppler, hearing the baby. And
say that one more time for the people in the back, because I don't think a lot of people have been told that it's the same.
Yes, the Doppler.
Yeah.
So yeah, the Doppler does use ultrasound to listen to the heartbeat. That's how it works, is it creates reverberation back, and you're actually getting the reverberation from the machine to kick back the sound of. So it's not like a fetoscope, where a fetoscope, you're sort of just listening and it can go through the different tissues and you're hearing the sound, you're amplifying the sound. The Doppler is actually using ultrasound to go push back and hear back. So it's kind of like an echo from the sound that it's creating from the Doppler.
And if you know this, is it true that Doppler is more powerful than ultrasound? My understanding and what I've always told families is 5 minutes of Doppler, which we don't typically do that long, but 5 minutes of Doppler is equal to like a half hour of ultrasound. Is that accurate? Yeah.
Yeah, because so there's a difference between, there's pulsed ultrasound, which is what is used typically with the picture ultrasound. So it'll ultrasound and then it'll take a break, and then it'll ultrasound and it'll take a break, and it puts all of that information and makes a video. Although it is, I mean, you can see the baby move on the ultrasound, so it's not like, it's like a fast flip book as opposed to a slow flip book, you know, like that pulse is pretty chopped up. However, the Doppler is continuous ultrasound. So it's constantly monitoring. And so there's no pause in the middle.
Is electronic fetal monitoring the same as Doppler? Like, where is that on the scope?
Yeah. So that's very similar to Doppler.
Okay.
More so. Yeah. So yeah, and then fetal heart monitoring, where they put the strap on the belly, typically in the hospital, that is, again, another form of ultrasound. Those all have potential question marks and should be thought of as a medical intervention. It's not the same as, you know, if I take a picture of you, you know, it's like, I don't know, even that gets a little weird, but if I take a picture of you, we can see that that's somewhat passive, right? The ultrasound, there are questions that we should be asking. One of them, and I can share this link with you, CNN actually ran a little piece in 1985. So the video is pretty old, but it is on YouTube, and I'll share it with you, and then you guys can put it in the description or whatever. But at the time that this ran on CNN, it said that there were no double-blind safety studies that had been done with ultrasound. And we're talking 38 years later, and that's still the case today. So what happened, and we have to look at the history of ultrasound, is from the 50s to the 70s, we took x-rays on pregnant women, and we were looking to get information about the baby on the x-ray. And then what they came out in the early 70s, they started realizing that the x-ray in the baby actually was causing different types of cancers, leukemia, and other various cancers. And so then they said, oh, well, we can't do x-rays on pregnant women. Well, we have to have diagnostic imaging. So immediately, without any safety studies being done, we started doing ultrasound. And we said, oh, well, it's just sound waves. Well, x-rays are just light waves. You know, like, I mean, so the clip on this talks about bioeffects when they do ultrasound on mice. There are bioeffects or bioalterations on 10 generations of the mice. So if you do an ultrasound on one mouse, for the next 10 generations, there's going to be altered bioeffects. Whether those bioeffects are good or bad, that's up for us to decide, but we'll talk more about that in a minute too. What we also, and then in the early 90s, the FDA deregulated ultrasound, and it's still deregulated today. So what that meant is that we got to have a rise of vanity ultrasounds or non-diagnostic ultrasounds or more intense ultrasounds. And that's where we get into our 3D ultrasounds and our 4D and our HD live ultrasounds and that kind of stuff. And every step of those ways, we remove the pulsed ultrasound and we go more a continuous, which is more intense. And then, yeah, I mean, in the FDA decreasing or increased the allowable intensity for prenatal ultrasounds, and that's also what kind of led more to the 3D, the 4D, the HD ultrasounds. So because they deregulated it, people are like, all right, well now more is better, right? We can see the baby's nostrils more, and it's like, oh my gosh, okay. Do we necessarily need to? And then the New England Journal of Medicine did a large study of 15,000 low-risk pregnant women who participated in a randomized controlled study to determine whether ultrasound screening decreased adverse prenatal outcomes. This study demonstrated, and they've repeated this study, but this study demonstrated that among low-risk pregnant women, ultrasound screening did not improve perinatal outcome. So if it doesn't improve the outcome, okay, that's also something to consider. The other thing that happened is, and it was known that it would also increase the cost of the whole pregnancy care. And of course, this is 1993, and now we're seeing the effects of prenatal care being an astronomical expense to have a baby in this country now. And part of it is that ultrasounds, you have ultrasounds if you are, I haven't looked at the last statistic most recently, but the last time I was reading it, the average woman has 6 ultrasounds per pregnancy, and that's just diagnostic. That's not including Doppler or fetal heart monitoring during labor and delivery. So the average woman is having 6, which means, you know, I had 1 for 30 seconds, but somebody else then had to have had, you know, 11 for that to come out.
When we have late to care transfers with moms, it's fairly common for them to have had an ultrasound at every visit.
Yeah.
Every prenatal visit.
Yeah, that's why I think we're saying 6, but I think it's a lot more than that. One of my chiropractors in my office went to a prenatal appointment and they were like, well, if you don't want an ultrasound, we have nothing to offer you.
Yeah.
And it was like, wow, like that's not even true, but okay. Like,
and with non-stress testing, I mean, it used to be like 41 weeks and 3 days, they'd start saying, oh, you should come in for an NST. And now, I mean, just across the board, I mean, if you're 35 and 4 days years old, you know, you get starting at like 36 weeks every week for low risk. And so, it's just money.
What can we bill for? How many things can we bill for?
So one of the things that ultrasound does, the reason that it works for therapeutic purposes, is it increases heat to the tissues, and it increases heat and it penetrates deeper through tissue. So it's not superficial. So when we ice something, for example, when we put ice on it, we're icing like the top few layers. When we use an ultrasound, it's a deeper heat that's able to penetrate more than if we were to use like a hot pack just on our body. So tissues absorb the energy and temperature rises whenever exposed. During the first 10 weeks, the ultrasound beam is exposed to every cell in the embryo. So the other issue that we're seeing is that if it's almost near impossible at this point to do a double-blind study on people who have had ultrasounds versus people who have not had ultrasounds, because if your mom had an ultrasound and you are female, then your ovaries were ultrasounded. So the effects of your baby are still long lasting. And we can see this. I mean, if we look at medications, like diethylstrobesterol, right? That, or DES, that was given to a pregnant person to avoid a miscarriage. And ultimately the daughter of that person taking it would have deformed uterus. So we can see that this happens in medicine. It's not, this shouldn't be so out of the question that it's possible to cause issues. The other thing is in later pregnancy, exposure around the skull increases heat to the brain as the bone magnifies the thermal effect, which continues long after exposure. So it holds the heat for a long time too. And that's one of the things, that's why ultrasound actually therapeutically has a lot of benefit, because of that deep penetrative heat. Although when we're doing that on babies, it's, you know, maybe not the best idea. The other thing that I want to mention is contraindications for ultrasounds. For us, like as chiropractors, when we're learning in school, contraindication for ultrasounds is pregnancy, and then over any open orifice. So eyes, ears, mouth, anus, vaginal canal, anything like that, you're not supposed to ultrasound over. Which if you're ultrasounding an embryo, you're ultrasounding everything. The other thing that can happen is the formation of gas bubbles, and those are called cavitations in the embryo. And what can ultimately happen is those can burst afterwards, creating like a tidal wave, but also increasing the risk of like different things like stroke, and stuff like that with the baby as well. One of the other things is to look at the false positive rates. This is a little like excerpt I'm going to read from my paper that I had written. It says, of course, prenatal ultrasounds have great benefits. They do. I'm not going to deny that. They can detect congenital problems, which give parent a choice to terminate the pregnancy, or in some cases perform intrauterine surgery to correct the problem. However, with these incredible leaps medical professionals make, it is important to look at the false positive rate of diagnosing abnormalities. Screening ultrasound does not and so this is a quote: screening ultrasound does not does not significantly improve outcome in terms of perinatal morbidity or mortality in the infant or the mother. Other research states screening ultrasound does not improve prenatal outcomes on the basis of clinical judgment. What research has shown is that routine ultrasounds improve routine prenatal ultrasounds provide a better gestational age assessment, early detection of multiple pregnancies, so twins, triplets, and detection of fetal malformation in some cases. Studies suggest routine prenatal ultrasounds have not been shown to improve ultimate fetal outcome. In this trial, 2.4 per 1,000 pregnant women in the scanning group were unnecessarily disturbed by false diagnosis of malformed fetus, which turned out to be normal. In comparison, 2.7 per 1,000 pregnant women were preserved from delivering a malformed baby. This would mean that in this study, if an expecting mother was told that her baby had an abnormality, there was a 50-50 chance that that was actually the case. In a situation as this, often the price of a misdiagnosis is termination of the pregnancy, or at least unnecessary stress on the mother. So what we're saying in English, what that means is that when they did a large study, and what they found was that about half the time that they were told, hey, there's a congenital malformation, it turned out that that wasn't actually true. Mm-hmm. And so
We see this in our clients too.
Yeah.
Where there's like 2 weeks of stress, and then luckily they find out that everything's fine, and there's nothing more drastic than that. But it's
and this is the problem that I have with prenatal ultrasound in general, is we're taking diagnostic mentality for adults or even children that are born, and we're taking those same principles and we're applying them to a developing fetus. So what I mean by that is, if we took an ultrasound and zoomed really close in and we saw that at 6 weeks, I don't know, I'd have to go back, but at 6 weeks, the baby had no arms, right? Well, of course not. The baby doesn't have arms at 6 weeks, you know? And I'm also not trying to use triggering language, embryo, fetus, whatever you want to call it. I'm just, for non-complicating circumstances, I'm just saying baby. But if it had no arms, we wouldn't like, oh my gosh, this is so, abnormal. Well, of course not, because there are stem cells. The baby is developing at such a rapid rate. So I also don't necessarily think that the false positive rate is wrong. I think what's happening is we're seeing it that day. The baby then grows more brain or more whatever. And then we go back 2 weeks later, and it's fine. But the amount of cortisol that has been dumped into that baby from that mom, the amount of, what'll also happen is disconnection that mom is going to start to feel from that pregnancy. That to me is the real crime of it all. That to me is the really wrong part. And, so this study came out, and immediately after this, after I wrote my paper, one of my best friends called me, and she's like my childhood best friend, basically my sister. She was like, hey, I went to my 20-week ultrasound, and the brain is not developing the way that we would want it to. And so I am choosing to terminate. And I was like, oh my God. And so I said, listen, go back and ask your OB, because I'm pretty sure that there's not a lot of difference in terminating a 20-week pregnancy as opposed to a 22-week pregnancy. And so I said, go back and ask them if they'll just give your baby 2 weeks. And my friend was like, I don't want to do this. I don't, and I said, look, this is like my nephew and I can't make you do the right thing. And the right thing. I said, I can't make you do what I want you to do. And I said, I'm going to love and support you through whatever you choose is right for you. But please look at the research. Please understand that it's possible. We're dealing with a moving target. We're dealing with something that is developing. And she was like, okay, yeah, I'll go. I'll wait. And so she went back 2 weeks later, and they were like, oh, the baby's brain grew. And I was like, well, no shit, the baby is developing, and I was like, and that's not always the case. And I, again, if somebody's listening and that wasn't the case for you, I don't hold judgment on choices that you make, but I want you to be informed in the choices that you do make. And so for my friend,
doctor had said that to her, like we could terminate, or we could give it another 2 weeks, and just that women are, they're not being given all the options.
Admitting that they're capable, that they aren't all knowing, and into the possibility that it's not a perfect thing.
I got that question a lot after my son was born with like a lot of birth defects, not right away, but people asked if I wished I had done an anatomy scan so we could have like known some things. And I was like, maybe my answer would be different if he had like died or something like that. But I'm so glad I didn't know, because I had a beautiful home birth and a pretty stress-free pregnancy. Like, I'm glad I didn't know, And I know that's not the case for everyone. Some people want to know. But I was grateful that I didn't know.
Right. Yeah. And so that's kind of, I mean, that's also part of it, is you were able to go through a beautiful pregnancy, connect with your baby. So by the time Ben was born, you already were in love with Ben. You know what I mean? Like, you met the love of your life that day. And then you were like, okay, well, now we have to deal with all of these situations. But
Um,
the American,
Oh, go ahead. I was gonna say, my brother, when his wife was pregnant, they went into Kaiser for an early ultrasound, and my mom and dad had guessed our sexes, me and my brothers, based on the heartbeat. So they were like, it's 100%, you know, like we're right every time because we did it for 3. So my mom, of course, was like, what's the baby's heartbeat? Because she wanted to try to guess. And my brother said they actually didn't do the baby's heartbeat at that appointment because they said new research is showing that when we do ultrasound on like, you know, the embryo, that they're more likely to develop heart defects until like a certain point, then it's like safer. And I remember being like, that's awesome that they're learning that. And why does it only apply to the heart? Why does it only apply to like the beginning stages? You know, like couldn't this, like, are we going to find out in 2 years or 5 years that it actually is affecting the whole embryo, not just the heart? Yeah.
Right. Well, we already know that, but I'll continue.
Kaiser doesn't.
So I have a question, and also just a rant about ultrasound and
here's your mic.
Thank you. When I, you know, and this is when I talk to people in my life who will listen to me again about birth, or clients, is like, you know, there's just not a great history in gynecological and obstetric care for women. There's, you know, there's I can't pronounce it. You know what I mean? Yes.
I didn't even know what you were trying to say.
DES, X-rays. I mean, you know,
Copolamine, you know, all of them.
Personal favorite is when they used to tell women to do douches with Lysol.
Oh my God.
Or, for example, to smoke cigarettes to have smaller babies. And this was like
trial and error.
You know, totally. So when people are so shocked that you would question something routinely done and told that it was safe, there's this disconnect.
Right.
And we all do it in different areas of our life, I assume, but like this area in particular is it's just so shocking.
And did you have ultrasounds in your pregnancy?
So with my first daughter, I did.
And I did too with both. So I just wanted to frame that we're not, like, we didn't, you shouldn't either. Like I did like one with each of my children. Like, so it's not about you shouldn't be doing this. It's about like having all the information so that when you choose it, you go, I feel like this is necessary for me, you know?
Yeah. No, with my first daughter, I had probably 3, I think. I did the early ultrasound. I had an extreme amount of anxiety about miscarriage with her. And so I was like counting the seconds until that ultrasound to see the heartbeat. And it was, you know, at first I didn't see it because I was like 6.5 weeks and I was like bawling, like it was very emotional. So I'm really grateful for that ultrasound. You know? And so I did that. When I had my 20-week ultrasound, they told me that I was going to have a cesarean because my placenta was, you know, low lying or whatever. And the tech just very flippantly said, oh, you'll need to have a C-section, and like making notes. And I, of course, went home and was hysterical. And then went back in a couple weeks and it had totally moved. And now I had a vaginal birth. And with my second, I didn't have any ultrasounds at all. And I only used the fetoscope. We used the Doppler in labor, but my midwife got there about 15 minutes before she was born. So I think we listened like one time. But it's like, you just don't know what you don't know. So my question is about sound, because like, I noticed with my first daughter during the follow-up ultrasound for the possible previa, it really looked like she was covering her ears. Like it looked like she was like having not convulsions or anything, but she was having a physical reaction.
It's like they run from it
to the ultrasound. And I remember,
and they call that the ultrasound wave. They're not waving; they're trying to hide themselves from it.
When they're like, "Oh,
because they're being hurt."
Up by the face. So, like, they hear, like it's loud for them. Is that right? Like, have a reaction to that.
Yeah. So one of the things is like that they say they've quantified it and said that it's similar to you standing down in like a subway platform and a subway rushing by you at like 60 miles an hour. It's about that many decibels. Now that has been questioned to be like, well, is it really that loud? Is it really? And what they have shown over and over again is that, it's loud, because the other thing that happens is ultrasound is not just sound waves. When it has to go through embryonic tissue, amniotic tissue, amniotic fluid, it then also becomes a mechanical wave. So it also, you can hear it. That's why if you stick your head in a pool and they're doing ultrasound, you can hear it underwater. But you can't hear it if you hold an ultrasound machine up. You're not, you can't hear it, but it's through that water that you then can hear it. The American Institute of Ultrasound and Medicine says that ultrasound is a form of energy that affects tissue it transverses, meaning tissue that it passes through. Therefore, its use should be restricted to medical indications by trained professionals for a short period of time, as low intensity as capable with accurate diagnosis. So that is the American Institute of Ultrasound and Medicine saying, hey, let's just reserve this for medical use, and let's try not to do those 3D, 30. Let's just take as much information as we can get.
I'm thinking of all the pocket Dopplers that women are just like buying online now and just like listening.
Right. And that's, that's it, is those can be, and then they also said that there still remains a lack of knowledge regarding bioeffects of ultrasound and safety issues. So that's the journal, or that's the American Institute of Ultrasound and Medicine. So the big one that really was an aha thing for me, and like, I might be like getting my tinfoil hat out here. Was Dr. Ang, A-N-G, did a study where they looked at it says the neurons of the cerebral neocortex in mammals, including humans, are generated during fetal life in the proliferative zones and then migrate to their final destinations by following an inside to outside sequence. So basically, as the brain develops, you have neurons that are supposed to migrate to the proper cortical layer. And that gets really into like neuroanatomy and all that, which I don't really, doesn't seem appropriate for a podcast like this, but basically, as the brain develops, your neurons are going to migrate and be at those specific cortical layers. What they did is that the present study, so this study that he did, examined the effects of ultrasound waves on neuron position within the embryonic cerebral cortex in mice. We used a single BRDU injection to label the neurons generated at embryonic day 16 and designated for the superficial cortical layers. Our analysis of over 335 animals reveals that when exposed to ultrasound waves for a total of 30 minutes or longer during the period of their migration, a small but statistically significant number of neurons fail to acquire to the proper position and remain scattered in inappropriate cortical layers.
That sounds important.
Or the subjacent white matter. What?
I said that sounds important.
It sounds important. So basically what they're saying is that the neurons fail to migrate. They call it neuronal migration, failure of neuronal migration to the proper layer. Now, this is where I'm getting a little bit on skinny branches with that. But when we look at certain types of autism, what we see is that in certain types of autism, there are children where the neurons fail to migrate to the proper cortical layer. And that's why their brains work differently. Now, does this mean ultrasound causes autism? I have no idea. And I think in 100 years, we'll know a lot more. But it is something that we need to think about and at least understand that we're altering brain development when we do ultrasounds. And so other various adverse effects that we've seen from the different research is there's an association between prenatal ultrasound exposure and delayed speech. That has been well documented, or that's well documented from Dr. Campbell. The other one was more exposed children tested positive for dyslexia than children who had not been exposed to prenatal ultrasound. This one was kind of funny, sort of, but you have to understand neuroanatomy with this one because it's like, what? I'm not, whatever. But ultrasound exposure in fetal life increases the risk of left-handedness in men, suggesting that prenatal ultrasound affects the fetal brain. The one by Eng, when mice were given injections to label neurons designed for superficial cortical layers, the mice were exposed to a total of 30 minutes or longer. There was a small but statistically significant number of neurons that failed to acquire to the proper position and remained scattered in the inappropriate cortical layer or subjacent white matter. So there's definitely brain changes that we're seeing as well. We have
pretty hard to do these studies because it's so hard to find a comparable amount of people who didn't have any ultrasound. I mean,
exactly.
Like in the 90s.
And again, because we're including Doppler, or like even when they do studies, would it include those things or would it just ultrasound?
Yeah.
Right.
Uh-huh.
Right. So it's getting more and more difficult because that number of people is going down. Now with mice, we can use that because, mice are ones that they use for medical testing all of the time for different things. And their life is a lot shorter and their gestational periods are a lot shorter. So we can get
generation faster.
Exactly. A lot faster.
Oh my God. So many more things I want to talk about. I know we're like getting close on time. Is there like if we ended now, is there anything else that you kind of want to convey to people listening? And maybe we need to do a ultrasound season 2 or something.
Part 2. I'm coming back. Yeah, I mean, I think
also if you're listening, if you have specific questions, that would be really good because maybe we'll follow up.
Yeah, I'd be happy to go through those. I think the biggest thing is that we live in a society where ultrasound is the kind of gold standard in obstetrical care, and I don't believe that people who are suggesting routine prenatal ultrasounds, I don't believe that they're malintent or evil or I don't think that that's the case. I think that we as Dr. Toms said, that we operate on a Titanic mentality, that safety is assured, therefore precautions are unnecessary. Oh, we don't need to do it. We've been doing ultrasounds for 40 years. And it's like, yeah, but you look at the autism rates and how those have spiked. Look at the miscarriage rates. Look at the, I think there's so much more to it than people actually understand. And most of the ultrasound studies are outside of the United States. And I can't help but think that has to do with money and funding and all of that. But at the root of it, I don't think that medical doctors or midwives or people who are pro ultrasound or wanting to understand the information are bad or wrong. I just think that they might not be current on what the research is saying, or having the understanding that it doesn't necessarily, just because we've been doing it for so long, doesn't necessarily mean that it's safe.
Yeah. It's hard. It almost feels like Russian roulette because it's not like you get an ultrasound and your baby's born without arms. It's not this like clear cut, it's like, well, I know lots of people who had lots of ultrasounds and their babies are quote unquote fine. And, so it can
totally.
It's the inability to question what you've been doing for years and years and not want to
Right.
face that potential. But yeah, if you look at us as a population, we've got a few things going on that aren't great.
Right.
And again, I'm not like a conspiracy person, but it's hard not to like even question it. And,
Right.
I have people, women who reach out about whether like ginger tea is okay to drink.
Right.
There are sources that say you shouldn't drink it in pregnancy or you should avoid ginger. So
Right.
people that are afraid to drink ginger tea are getting,
But won't even blink at the
right,
ultrasound.
but are potentially getting 3, 4, 5, whatever ultrasounds, not usually home birth clients, but like when I was a doula, all of that stuff. And it's just so
Right.
shocking, it's just
Right.
really, yeah, there's that disconnect.
Yeah.
Jen, I want to talk to you forever.
Well, that's why you just got a membership.
Yes,
You're
that's
gonna
why
go
I'm
hang
gonna come in.
out.
I'll be like, investment, but
Let's talk.
let's talk.
Let's chat.
Crack my back about ultrasound.
Well, thank you so much for coming
Thanks,
on
Jen.
again. And clearly we will have you back.
Awesome. Well, thank you so much. And yeah, cool. Have a good day.
Thanks everybody for listening. You can find us at Born Wild Podcast on Instagram. For inquiries or feedback, you can email us at bornwildpodcast@gmail.com. You can find me, Emma Ray, on Instagram at Emma Ray, REA.
Sophia at sophiabirth.com.
And me, Leah, at Bay Area Home Birth.
We would really appreciate it if you would rate and review us on Apple Podcasts. It helps us reach more people. And as always,
Stay wild.